Hello, my name is Dr. Catherine Dean. I'm the Access Ambassador to the University of East Anglia, and I'm going to be talking to you today about this topic around lab accessibility, why it currently sucks, and why I've developed some guidelines that will hopefully help solve this issue. So, the Access All Areas and Labs project surveyed disabled scientists to identify barriers and solutions to access in laboratories. We also created a series of case studies and then created the Disability Access Guidelines for Labs. There's also a web page full of a repository of other resources. These guidelines did inform the design of a clean room pharmaceutical lab up in Edinburgh. The survey recruited in a month 152 scientists with an interest in lab access. 55% of those scientists were disabled, 93% had experience of working in a lab, and most were based in the UK. Biology and biomedical sciences dominated, and most of the labs were in university or healthcare settings. Invisible impairments were most common. Fatigue was present in over 90% of our respondents, pain in 80%, brain fog and mood in over 70%, and over half of our respondents. Unfortunately, this comment summarises the results of the survey. One of our respondents said, "My lab broke me. I hope others are better." Unfortunately, at the moment, that isn't the case. A quick summary of the results is that structural access to buildings and labs is poor. The behaviour, attitudes and knowledge around disability and accessibility is poor. Initiatives to change ableism are tokenistic and viewed as ineffective. Web pages and conferences are often inaccessible. This poor access and the poor attitudes around access lead to poor safety, unlawful practices, poor recruitment and poor retention. We're getting the basics wrong. Ergonomics, not actually specifically around disability access, just basic ergonomics. So less than half of the labs had ergonomic adjustable seating. Most did not have height adjustable benches or equipment. Just 9% had height adjustable benches, 6% fume hoods that were height adjustable, or 4% for Cat 2 microbiological safety hoods. Toilets, only 68% of labs were in a building that had an accessible toilet in the same building. So that's a third of labs, thereabouts, having to require people with disabilities who require an accessible toilet to go outside the building they're in and go into another building to go to the toilet. And even when you had toilets, their general visual access was poor in most cases, and only 12% of places had a changing place accessible toilet. That's a large accessible toilet with a hoist and a bench. Mobility and sensory access. So mobility access, 88% of buildings did have step-free entrances, but that's still 12% that don't. But only 18% of labs had step-free access. 6% of buildings didn't have step-free access to higher floors. Now that doesn't sound too bad until you realise that those buildings could be 5 or 6 stories high, and the labs may well be on the second or third floors. And effectively, that means that 6% of buildings are excluding the vast majority of people with any significant mobility impairment. Powered doors, well, 75% have their front door powered up, which is great. Still a quarter of buildings don't, but only 27% had internal powered doors and 10% had their lab doors powered up. I speak from personal experience, having a powered door is really important and really can be quite damaging if you don't have those. And even if you could get into the labs, less than a third of the labs actually had a 1.2 metre turning circle, which, by the way, is smaller than the 1.5 metre turning circle required by British standards. Hearing loops were very infrequent. Less than a quarter of buildings had them and only 8% of labs did. Good colour contrast was pretty infrequent. The contrast between floors and walls was only present in 37% of buildings and 22% of labs. Being able to see the handles compared to the cupboard door is 21%, and socket fascias compared to the wall was only provided a colour contrast in 9% of places. And 19% provided clear visual markers on their glass walls or partitions. So navigating your way around these buildings visually is really challenging. Benches were mapped in only 65% of cases. Now, a glaring surface, a surface that reflects light badly, can really be disorientating and bluntly quite blinding for people with visual impairments. And again, basic ergonomics task lighting was only provided in 22% of buildings and 21% of labs. Really, that's very basic and it's still not being provided. Fire safety is when it starts to get quite scary. We found that only 13% of buildings had a fire safe lift. That's BS 9999, which was brought in 2017. So considering this is quite a significant structural change to implement, that's not particularly surprising. However, if you don't have a fire safe lift that you can use to evacuate people with mobility problems in particular, you're going to need alternate means of evacuation. So to find that less than half of the labs actually had evac chairs and that 20% didn't, despite people saying they probably needed them themselves, it's particularly worrying. Less than half of the buildings again had dual alert fire alarms. That's an audible and visual alert. Again, 35% of respondents said they didn't have this, but they thought it would be useful. 59% of buildings had all their ground floor fire exits being step-free, which is great, but a third of them didn't have that and did want it. Could see that having steps on some of the fire exits could hinder appropriate evacuation. Now, personal emergency evacuation plans, PEEPs, are required for fire safety of people with significant mobility, visual or auditory impairments. And we had 38 respondents who said, I would need a PEEP, but only 8 of them, that's 21%, actually had one. Now that's both illegal, blatantly unsafe, and you can see where there is really significant lack of respect and care for disabled scientists if you can't even be bothered to make sure that in the event of fire they can safely evacuate. Similar issues were identified with low working policies. Again, 36% wanted them to be adapted, yet only 4, that's 11%, had an appropriate home working policy. Disability accommodations. This is for the respondents that needed them. So we have 11% had managed to get building infrastructure adapted for their needs. 11% had got an accessible parking bay that they needed. 65% had managed to get accommodations in the way they work, so flexi time, part-time, such like. 30% had had equipment adapted, and 35% had had adaptations to tasks. They were either adapted or handed over to others. However, everybody said that the vast majority of respondents said that there was a culture of long working hours. 64% said that. And of those that were disabled, 83% said this long working hours culture is detrimental to the disability management of their symptoms and their well-being. Unfortunately, it's not just structural, it's not just policies, it's also culture. And we have bullying and discrimination being common in this population. 31% have witnessed bullying of a disabled person, and 44% of the disabled respondents had been bullied themselves in the last 10 years. 22% had reported any such bullying. And 53%, over half, would feel comfortable speaking out about disability bullying or discrimination without feeling that they would suffer negative personal consequences. However, that might be because less than half, 47%, did not feel that concerns would actually be acted on appropriately. So you can report it because it won't actually lead to any difference. And unfortunately, 27%, just less than a third of people really believe that disability had no negative impact on promotion prospects. So the culture in labs and in research is fairly negative. There is, however, a desire for change. 78% of our respondents wanted EDI, equality, diversity and inclusion initiatives for disability to go further. 32% had actually seen successful initiatives in action. However, over half of them believed that those initiatives were mostly tokenistic. Now, there really is a desire to change the infrastructure in which access occurs, in which lab work occurs. 88% of respondents believe grant funders needed to require high access standards in the labs they build and refurbish. So these guys are funding the building of new labs and refurbishment of old ones, and they're not requiring the highest possible access standards. And bluntly, we think they should. And 91% of respondents believe that grant funders should require all labs to meet a minimum disability access standard. And this is something that I'm hoping the guidelines that I'll talk about in a minute would aid you with. So our mission on the guidelines was to remove the barriers to accessing life so people can express their brilliance. We have a suite of access guidelines covering structural, equipment, protocol, dissemination and working practices access. We have a full alphabet soup of interested parties that have come to us after this project, which has not yet been really well advertised as we have yet to get our publication out of the survey. But we have a wide range of funders, of societies, of learned societies, of lab equipment manufacturers, and even contractors who build labs interested in these guidelines. They are what people are looking at and going, this is exactly what we need. We need to be doing more of this. So all of the guidelines were based on the principles of the social model of disability. The social model of disability states that as a wheelchair user myself, I am not disabled by using a wheelchair. I am disabled if your building does not have a ramp to let me in. So in other words, the responsibility for making the adjustments is not mine. I should not rehab more, do more exercise or put on an exoskeleton. I should have a society that takes on the responsibility to accommodate the variance and diversity of the entire community, not just those who are so-called able-bodied. These guidelines really wanted to challenge the negative assumptions that are often out there, particularly in lab working, that disabled people are a health and safety risk, that access solutions are too complex and too expensive to implement. And we wanted to bring together existing guidelines into one location. There are very few pieces in the guidelines that are actually novel. Most of them are existing guidances and guidelines that we've brought together, refined with the data from the surveys and the case studies, and we've highlighted the issues specific to labs. But actually, the vast majority of the guidance is relevant to any setting. All employers have a legal duty under the Equality Act of 2010 to proactively make reasonable adjustments to remove, reduce, or prevent any disadvantages that disabled workers face. In order to achieve equity for disabled people, work may need to be organised differently, support provided, and barriers removed. The 7 principles of universal design are: 1. Equitable use. The design should be useful and marketable to people with diverse abilities. So really think about the whole spectrum of disabilities and impairments and whether or not something could be used with equity, in other words, with equal ease, with equal functionality by people who were blind, who were neurodiverse, or had mental health challenges. Flexibility in use. The design should accommodate a wide range of individual preferences and abilities. Very similar principle, very similar idea. That flexibility, being able to adjust the height of your seat, the level of lighting in your work area, and whether or not you can get in using a wheelchair or not. Principle 3, it should be simple and intuitive to use. Use of the design should be easy to understand, regardless of the user's experience, knowledge, language skills, or current concentration level. It should be intuitive to use. Principle 4, perceptible information. The design should communicate necessary information effectively to the user, regardless of ambient conditions or the user's sensory abilities. So, does it work if you're deaf? Does it work if you're blind? Does it work if you're in a loud, distracting environment? Principle 5, tolerance for error. The design should minimize hazards and the adverse consequences of accidental or unintended actions. Principle 6, low physical effort. The design should be sufficient that it can be used efficiently and comfortably with a minimum of fatigue. Principle 7, size and space of approach and use. Appropriate size and space must be provided for approach, reach, manipulation, and use, regardless of the user's body size, posture, or mobility. And as a wheelchair user, I can really state that this is really a significant principle that unfortunately is currently not often applied. We really looked at having an overall attitude of embracing the all access attitude. We really wanted to highlight that in the vast majority of cases, access can be provided irrespective of the level of impairment. But we also wanted to highlight that you had to test for accessibility with real users. Consultation is absolutely critical to refine the access solutions to make sure they really work in the context that you're working in. And always, accessibility is cheaper when it's done up front. In the context of buildings, for example, I have powered doors that were put into my new building, New Science, that cost me between £1,000 and £2,000 to buy and install. When I have been refurbishing doors and putting in powered doors in older buildings, it can cost up to £15,000 to do those. So it really is a substantial difference in charge to retrofit access. So let's go through the guidelines in a little more detail and just talk about the generalities. The specific details, the exact numbers and specifications are all detailed in the guidelines or specifically linked to the links of the original guidelines that I borrowed the advice from. And we think we've managed to hit the right balance of having enough detail that you can get on and use them, but that it isn't too overwhelming in their length and their detail. So, in terms of structural access, when considering things like mobility, One of the things to consider is that wheelchair users in particular need a lot of space. You need to provide generous turning circles and things like having space to approach a piece of equipment, so knee nooks, things like that. And additionally, whilst a single wheelchair user will usually take 1.5 to 2 people's spaces when you're calculating the space needed for them in a building. However, when you've got 2 wheelchair users in a single space, they'll need about 6 people spaces in order to allow them to manoeuvre around each other and circulate freely. Grab rails in any location that you need to transfer from a wheelchair to a chair, to standing, to changing their clothes. And you may wish to consider if a hoist might be appropriate in some of these locations. You really should consider, if you're building brand new or you have the money to insert a new lift, that you want to have 2 fire-safe lifts per building. This allows for redundancy in the event of maintenance or faults, and I can assure you it makes a huge amount of difference to the accessibility of the building in practical terms. The lifts and toilets should not be the absolute smallest possible. They should be large enough to have space for carers. Again, we've specified the exact dimensions in the guidance, but that's really what we're thinking about. We're wanting to have room so that a carer or 2 can assist the wheelchair user to press the buttons in the lift or get on and off the toilet with dignity and safety in a toilet. Dexterity and strength. All taps should be lever type. That sounds really easy, but then let's start looking at what sort of taps that you have and what sort of controls that you have, particularly in cabinets, safety cabinets and so on. And there often it is rotational. And rotating your hand requires a lot of muscles, bones and nerves all to work together effectively. Whereas a lever, you just have to be able to move your shoulder, your elbow, your wrist. There's only one joint that really needs to work to make a lever tap work. All doors should be light, and by that we mean 30 newtons effort to open them, and that means that in practice most doors need to be powered up, or they need to be held open on magnets that then release in the event of a fire alarm, or they're very, very light and they have nothing to impede their motion. Door handles and locks should have easy grip, so D-type, so you can get your fingers behind it and you don't require dexterity to pull or rotate the handle, and should have good colour contrast. Sensory access, good colour contrast, matte surfaces, good lighting. Signs and alarms should have 2 modes, so audible and visual fire alarms, visual and tactile signs. You need to think about the auditory environment, sound baffles, use of alarms or not, and where conversations are held should be considered in practical terms. Hearing technology must be provided. This may be a hearing loop, but it can also be some more digital technologies that are being developed that link through to phone apps or even to the hearing aids, etc., that people now use. Microphones must be provided for meeting spaces, and we'll talk more about those about organising events. Toilets, absolutely critical for accessibility. Think about it. Really go into a building and not expect to be able to find a toilet. Unfortunately, as a wheelchair user, I go into a building and absolutely have that expectation. And as I said, our survey found that about a third of labs don't have an accessible toilet in the same building. So we're saying, actually, we think you should have large accessible toilets, and they should be on every floor that you have workers on. You should consider providing a changing place accessible toilet. That's the hoist and the bench, possibly a shower as well, 12 metres squared. And if you can, put it in the building's foyer, put it in an area that the public can access. and then you provide a service to the community as well. If people are changing their clothes, hoists should be considered. And again, grab rails and seats obviously should definitely be provided in anywhere people are changing their clothing. And when I was building the new science building, I was at the University of East Anglia, which is a 4-storey building with chemistry, biology, physics and electronics labs built into it that is highly accessible. It was built on time, under budget, and really does prove that black swans do exist. I was told so many times it was impossible to build accessible labs, and I did. And I then repeated that with the Universal Design Lab, which is a clean room pharmaceutical lab that the Catapult Lab guys are using up in Edinburgh. Now, it's not to say these are perfect. There are things that you still look at and go, oh, I'd like to improve it just a bit more. But these are both designed to a very high specification and have really made a difference in terms of the accessibility of our campus and we hope the Catapult Labs. Access for equipment. You have to, first of all, consider the acceptability for the whole team. You've got to consider the impact of the access solutions on the work of the whole team. There are the possibility for clashes between ergonomic needs and access needs and different access needs. Perfect solutions for one access need might create a barrier for another. So consult to make sure that you have removed all the absolute access barriers and identified acceptable compromises that, whilst they may not be perfect for one type of disability, still provide access for another. Mobility access in terms of equipment. You must be able to operate the equipment whilst seated. Us wheelchair users aren't often able to stand up steadily and well enough to operate equipment. Electric wheelchairs, and I do speak from experience here, have the potential to create quite a lot of damage. We really have very fierce torque in our electric motors. So if we bump into it, knock into it, or we knock it accidentally, we could damage it. So the equipment needs to be appropriately robust, and its location in the lab and where it is on the bench does have to be considered. Strength and dexterity, as discussed before, all taps should be lever taps. All doors should be light. Door handles and locks should be easy to grip, so that D handle type, and should have good colour contrast. And there should be good clearance around buttons, whether these are physical buttons or buttons on a screen, to allow for lack of accuracy. So there shouldn't be too many tiny buttons that require great dexterity and, bluntly, small fingers to accurately activate. Sensory considerations around equipment, again, good colour contrast, matte surfaces. Consider colour blindness, particularly red-green. It's very common, 10% of the male population have red-green colour blindness. Ideally, consider putting in tactile differences for buttons or handles so that you can actually feel that you're touching it. The area that the control panel in should have good lighting. Signs and alarms, again, should have 2 modes, so audio-visual, visual, tactile. The equipment should be made as quiet as possible, and consideration should be given to baffling the sound, in particular loud equipment that can't be avoided, and consideration again should be made to alarms and whether they really need to be audible or whether they could just be linked up to an app on your phone that then buzzes in your back pocket. Flat screens are increasingly used as control panels for equipment, and these really do need to be considered in terms of access. So adjustable lighting levels, colour contrasts, choice of colours, adjustable text and contrast with the background really is critical and, bluntly, in electronic terms, relatively simple to provide. Connectivity could be a major lifesaver for a lot of equipment. We don't actually need a lot of equipment to be directly accessible if it is possible to connect it to an interface that is accessible. So, for example, if your centrifuge controls can be linked up to a text-to-speech panel that then can talk to somebody and tell them what speed it's running at, what the other parameters you wish to control are at, and that it can hear speech and be controlled by speech through that way, could make a massive difference to a lot of disabilities. So to do this, we need to start talking about standards, open standards, so that all equipment talks to all other equipment, because it all talks in a similar way. And if there isn't open standards, the EU is developing these, but they're not there yet, and we do have a lot of VHS and Betamax effectively going on still. So if you don't have an open standard that's agreed, then you do need to provide documentation on the interfacing protocol and not rely on proprietary hardware or software. Dissemination access. Now, this is about taking the information that's created in the research labs into the public domain. Now, this might be to consult on what priority a piece of research has, how it's designed, etc. So you've got consultation events, meetings with collaborators, conferences, etc. So let's talk about this. So document access. Simple text, short sentences, using images to aid comprehension. Text should be provided in a clear text format. Now, what I mean by that is that you use a sans serif font, that it is at least 12 points in size, it's left aligned, there is 1.5 line spacing between the lines, and it's printed or displayed on a pastel coloured background. Large print versions, which are usually regarded as 16 point and above, should be made available, and text should always have a plain background, so never put text against a picture. For web pages and electronic documents, the access considerations you should consider certainly is around prioritizing visual access. This covers 80% of web access issues. So ideally, the text size and contrast should be changeable. You should provide good alt text for describing all of your visual images. Videos need closed captions, and you should consider British Sign Language interpretation and audio description. Don't place important context out of the way where screen readers won't find it. Check mobile and screen reader accessibility separately, and check, unfortunately, a number of screen reader protocols, because there is, again, this incompatibility of protocols currently with screen readers. Don't disable Zoom in mobile interfaces. That could be absolutely critical for someone with a visual impairment. For event access, please plan ahead and include a budget. Make sure that your event adverts explicitly welcome people with disabilities and asks about their access needs, but obviously keeps that information appropriately confidential. Provide detailed information about the accessibility of the site, the transport to it, the food, the event, the organisation, etc. All aspects. There is no such thing as too much access information. This I can promise you. When you're considering virtual or hybrid events, visual and hearing access is the really important ones to consider. Make sure that auto transcription, which is usually an option, is available. but also that can be turned on and off, because for some neurodiverse people, it can be incredibly distracting. Again, you should consider British Sign Language interpreters, audio descriptions of significant amounts of visual information, for example, films, and note takers to give you accurate notes. About event access. Remember, your speakers themselves may have a disability. Again, as a wheelchair user, I cannot tell you the number of times I've had rather embarrassed event organisers realise that the stage is not wheelchair accessible. I've had to go up some very interesting ramps to get up onto it, which I can in my electric wheelchair. It's quite powerful and it's very stable, and I'm very confident in using it. But I could absolutely see that that might actually cause problems for other wheelchair users. Do make sure that you train your staff and provide information to speakers about expected standards of behaviour to promote access to everyone. Everybody should use a microphone in group events, both the speakers and the audience, and this is often because those with hearing aids will hear it a load better if the microphone is used, but actually again with hybrid events, if the microphone is not used, pretty much your online audience cannot hear what's going on. You should really consider the whole journey of accessing the event: transport, accommodation, food, rooms, all the sort of it. Quiet rooms are incredibly helpful for many disabilities, and of putting aside one room as a quiet room for people, it really is not a big additional requirement. Assistance dogs must obviously be admitted, and you can obviously ask that people use tabards to identify them clearly, but having water available for the dogs and a spend pound or an area where they can go and toilet themselves is incredibly helpful. Carer tickets should be free, and the proof needed to access these should be really simple. It's challenging enough and expensive enough to access many events as a disabled person without having to pay twice because you need somebody to assist you during the day. Working practice access. Now this is the HR stuff, and the core thing is around principles of disability accommodation. And in the UK, the really important thing to state is that the Equalities Act notes that it is not unlawful for an employer to treat a disabled person more favourably compared to a non-disabled person. So it's really important to note that. Key principles of disability accommodation are here. All workers deserve the opportunity to realise their full potential. That's my remove the barriers to accessing life so people can express their brilliance, please. Reasonable steps, all reasonable steps, must be taken to ensure that policies, practices, and culture do not discriminate against disabled people. And in general, the reasonableness of the accommodations have come down to cost and genuine impact on working practices. And they have to be quite substantial in both cases before the courts of law will believe that you could not, as an employer, have provided them. Some disabled people may not have a formal diagnosis or assessment, and we recognise that the lack of diagnostic support can be a barrier in the workplace for both workers and employers. But remember, it's not often the disabled person's fault that this is lacking. Sometimes it's just medically complex and we don't have diagnoses yet. And sometimes it is really hard to access those diagnoses. Disabled people face discrimination and stigma in the wider society, and so they may not be willing to disclose a diagnosis. Disclosure really isn't simple. It really takes a lot out of you to disclose to an employer that you have a disability. So this is where having a lot of built-in automatic processes that accept the diversity of the human population, let alone the disability levels in the usual employee population, is where you can actually have accommodated a lot of issues without it needing to be disclosed. Please remember that each person is unique and there can be a high degree of overlap between multiple conditions and protected characteristics, and that support needs must be identified and implemented on the basis of personal evaluation and individual need. Employers should commit to proactively working to eliminate barriers, including prejudice. They should be working to raise awareness of the full range of disabilities, including those that are often overlooked, for example, mental health conditions, dyslexia, neurodiversity, and so on, or just invisible disabilities such as epilepsy or diabetes. Employers should really consider changes made in response to requests for reasonable adjustments and making people aware of what is possible, what is reasonable, what is easy to do, and how those protocols are implemented, so that people feel confident about asking for changes to be made to their working practices, for example. Employers should commit to taking immediate steps to eliminate potentially discriminatory practices in employment that can arise throughout the course of normal day-to-day workplace activities. Ensuring workers know they have the right to be accompanied by their union rep in discussions about reasonable adjustments is really important. It really helps bringing the union on board, ensuring that that they have accepting that they have expertise and also knowledge of other accommodations that are done by other employers and maybe more creative and knowledgeable than standard HR personnel. And in order to make sure that this happens, paid release for union reps to attend relevant training really must be supported. And this should also include disability champions and other EDI staff to really attend union education courses on disability and reasonable adjustments and disability passports. The reasonable adjustment passport is promoted by Unison, and it really is a very simple document that allows people to consider what needs they have now, what needs they may have in the future, and what's changed since the last assessment. It's recommended that it's done on an annual basis, so it could be just added to annual appraisal, and it should really be done for all staff because health is a variable condition. People who are currently in good health may temporarily be in poorer health, and some simple adjustments may enable them to maintain the quality of their performance, or even that they maintain the job, even if the impairment is relatively short-lived, for example, that they're needing an operation. Protocol access is where we effectively bring all of those 4 guidelines together and go, how does this work in practice? What do we mean by what has got to be adjusted in the protocols that are run in the labs? So, how do we expect people to work? Full-time, part-time, flexible hours, work from home? Have their roles been adjusted so that they can maximise what they can do and it doesn't require them to do things that they find particularly challenging or aggravating to their symptoms? And have we considered where deadlines are there, whether they're reasonable ones or whether or not they need to be adjusted? How clear is it that it's the employer's responsibility to adapt and to do the majority of the work on the adaptations? Have they joined up their networks of support, mentoring, and do they follow up actions on complaints with training, recording of it, records of response time, records of how much it cost and how it was put in, or what was adjusted explicitly so that people can know what they're getting? Do we give enough support to our disabled employees through mentoring and specific support? Do we use inclusivity networks of whatever variety you wish to label them to share solutions and maybe run access workshops or clinics so that everybody feels confident about asking for help about improving the accessibility of a workplace? The benefits of accessibility is that a wider pool of talented and skilled and experienced people is available to you to recruit. Retention of highly trained staff is more easy and so represents a reduction in the time and money that is needed to recruit new staff for a position that is currently filled by a disabled member of staff. A dynamic and challenging workforce is able to respond to changes, whether this is in climate, environmental status, international relations, availability of resources, whatever it is. Having a diverse workforce is always a positive in being able to respond to change. A better understanding of foreign, global disability markets, a better understanding of the needs of a more diverse range of customers, clients, patients, and greater insight into the challenges faced by disabled people so products and services can be designed to ensure they don't automatically include barriers to their use that could actually be easily designed out. There are often substantial washover benefits for all staff. The technicians in my new science lab building love me because it means they can wheel their trolleys around because all the doors are powered up. They've got 2 lifts. They've got, it's flat floors. There's no steps. It means they can get about with all of their kit very easily and work very well. Training and policy changes impact on all diversities because disability is inherently intersectional. Anybody can become disabled at any stage in their life and with any other protected characteristic. So when you're training about disability awareness and accommodations, you inherently have to accommodate all of those other diversities and protected characteristics. And that must lead to a better workplace where all of those differences are valued. And having a more accessible workplace, having practices and policies that really support disabled workers is a clear demonstration of an employer's respect for their staff's needs in very practical terms. So some training that you may wish to consider is things around allyship. So again, based on the social model that everybody has a responsibility to challenge and improve accessibility. Obviously, you would want to consult with staff in the design of this training, but don't make them responsible for it. Audit existing policies, buildings and equipments against the guidelines that I've created. List every deficit, even if the money is not currently available, even if the technology doesn't currently exist. List what doesn't currently work, because eventually you may get a pot of money or you may find other solutions that are cheaper or easier or possible to implement. You need to upgrade access standards for new builds, refurbishments and for the equipment you buy. Make it meet the standards that I've created and you will have incredibly accessible buildings and equipment. Have an all-staff report policy for access barriers like the lift's gone down or the power door isn't working. Everybody is responsible for reporting that. The estates team are responsible for prioritising that, and also for that you have an all-staff reporting policy for discriminatory behaviours and poor behaviour around disability, and that leads to transparent tracking of actions and training undertaken. Regularly check the function of accessible equipment. It's no good having a red cord to alarm for a toilet if it doesn't alarm anywhere or nobody responds to it. Have an annual review that includes the reasonable adjustments passport for all staff. And remember, this can cover other protected characteristics that also need accommodations. So, for example, the young father who wants to pick up his children from nursery, or somebody who wishes to take shorter hours during Ramadan. Allyship in research really means that we need to think about implementing dissemination access guidelines in events and meetings in particular, and that's the budgeting it, auditing it, getting feedback, and providing contact lists and how-to guidelines for everybody to say that our events, our meetings, our consultations will be to the highest standard of accessibility. And when we're thinking about research which requires participation of people, then we should assume that some of those people will have disabilities that we can accommodate by providing information sheets that are in electronic and hard copy formats that are standard and large print size. That we should consider providing this information in British Sign Language, Visio and easy read formats. And that really the information sheet should have a "how are we making our research accessible for you" section. And we definitely need to train our ethics committees so that they also prioritise accessibility in as much as they do prioritise data security and other aspects of ethics. Bystander training is where you take on responsibility to interact and intervene when you see poor behaviours. Now, you may wish to reinforce this with role play or create little vignettes that people are asked to think about and think how they would respond and what they would do. You definitely need to challenge ableist assumptions, norm criticism, I've seen it described as, that to make work accessible, it would be dumbing it down. That making stuff accessible is too hard, too complex, too time consuming, that it would make lab working unsafe, or that it is too expensive and adds no value. All of those assumptions I've heard directly stated to me in a number of settings and should all be challenged because none of those are true. We definitely need to challenge ableist language, but I would highlight, don't get bogged down in it. Yes, I don't suffer from my disability. That's not an assumption you should make about me, whether I do or do not suffer from it. It's my decision, not yours. I am not wheelchair bound. That isn't my fetish. I'm a wheelchair user. It's a tool that I use. And obviously there are ableist offensive terms that I won't mention here that should be challenged every single time those are used. But we should be challenging ableist practices and designs and affirming reasonable. It is reasonable to expect that people differ in height, but let's include people of restricted growth in that assumption. It is reasonable to expect that people will have different levels of energy on a given day. So let's include people that have energy limiting conditions. It is reasonable to expect that people may want flexible working at some time points in their lifespan and their working practices. So let's include that for disability accommodation. There is going to be another talk called the Changemakers Toolkit with a disability focus, and here we'll talk about further discussions of effective tactics to take to action change to improve accessibility. There's the link for my Access All Areas in Labs guidelines. You're very welcome to download them and use them widely. Please cite us, but that's fine. And then thanks to the team that I worked with to create these guidelines. Thomas Fadden from Purple Reach Disability Access Consultancy is a fabulous disability trainer and really good consultant in the area. Highly recommend him. Jenny is a brilliant independent expert on knowledge exchange and particularly patient engagement. Both of them stepped in at very short notice to facilitate this project, and it really wouldn't have taken place without them. Peter Hemmings and Dan Bowell are technicians at UEA and provided essential, detailed technical knowledge to inform the guidelines that we used. Chris van der Waal was a star from the Catapult team, and there's my contact details as well. Thank you very much for your time. I really appreciate it.